Welcome to another episode of the SCHA-MI podcast. I'm Alex Frankfort, Communications Manager at SCHA-MI. Today we have with us Michigan State Representative Mary Whiteford. Representative Whiteford is a longtime champion of school-based health centers and just an all-around advocate for healthcare improvements and resources in the state. And she is currently making a push in the Michigan House Appropriations Committee, recommending an increase in SBHC funding to establish and open new centers across Michigan. Representative Whiteford, thank you again for joining us today.
Yeah, thanks for the invitation. Thanks for being, and I appreciate being here today.
Perfect. So we wanted to talk to you starting out, what are some of your favorite success stories from school-based health centers, some interactions you've had in the past? What has really stood out to you?
Well, as you may know, I'm a former pediatric emergency room nurse in an inner city hospital. So kids are my life. I'm a mom and a grandma of 3. What I see, and I live in a fairly rural district, is that so many kids don't have the way to get to see a doctor, a nurse practitioner, PA, whatever needs that they have. And it's quite challenging for many of our families. So it's a big issue about income, poverty, but even kids who are in the middle there, they can be left behind. So when I went and visited the Lansing School-Based Community Health Center, I was really impressed. The students can come in, sign up, people can be in the community. It's all true wraparound services, which is the key to access for care for people, and especially children who don't have that extra, they can't drive yet, and riding a bike over, but this way they get this help at school. So one is being developed in my district, which I'm really excited about. It's been a funky year right now, but I look forward to seeing what kind of successes that they find in my community. But like I said, it is key. We have to stop thinking that the only way to get help is to travel somewhere. There is a way to get help close to home, close to where the child is, and get those services started.
Absolutely. Yeah, and I mean, we've asked folks before, it's easy to see the value if you're a parent and it's your child who's getting these services right in their own school. But how would you, pitch the value of health centers to folks who are just in those communities but maybe don't have kids going to those schools? What benefits is it theoretically providing them, their tax dollars going to work?
Well, so many people, they really do care about the future of our state, future of our community. And so when they get behind or beyond the concept of what are children doing to saying, how can we have that warm handoff of services? It's very easy to have lofty ideals, but it's making those connections. And I think that's the biggest benefit that the school-based community health centers do. They make that connection, they make that warm handoff to make sure those kids are getting the help that they need. And a lot of parents, there's a lot of challenging families out there. We've had a high rate of depression, substance use disorder, mental illness, former foster children who are now parents. They need help. They need to understand what kind of collaboration that they can do and things that they can do to help their children to have better lives. Because ultimately, I worked in an inner city hospital. I took care of children from all walks of life. I never found one parent who didn't have good intentions. Many times they just didn't have the tools. So what these health centers are doing are actually helping the entire family. And for anyone, even if they don't have children in school, when they think about what our future as a state looks like, it's got to be an investment in these kids and getting those early connections. I'm the chair of a special task force on adoption and foster care. And some of the statistics that I heard were incredibly glaring. And one is that over 80% of people on death row are former foster children. Over half of the people in our jails and prisons, former foster kids. And it's definitely a generational crisis that we're facing right now. I think our health centers are a very important part of making sure that these kiddos, get that protection and support and help that they need. And in turn, you're helping the family and community.
Absolutely. So yeah, as you mentioned, you and your colleagues have really been making, especially mental health, priority, this session. So how does that fit specifically, into your agenda and into the state's agenda, this year and following the pandemic?
Well, about almost 10 years ago, I had a child who had some real challenges and depression, anxiety, some trauma, some bullying at school. And I kind of liken it to being, that big old pot of cold water and you put the frog in there and you heat it up. At what point is the frog going to really realize it's urgent? It's time to get out. And that's how it is as a family. Things are coasting along. You feel that little pang of something not right, but you're not quite sure about what to do next. For me, it was talking it over with my sister, and she's like, "Oh my gosh, she's gonna die." And I'm like, "Oh my gosh." It was like a slap in the face. So then I reached out for help. Nobody would help me. I couldn't get a single appointment, a single therapist that would see her. They had 6 months waiting list. And so I took that experience and I did find her help. She had to get admitted to the hospital, and it could have been so much smoother. And so that's why I started with a conversation with my mom. Mom, what do you think? If somebody can call a number and find somebody in the community who can help them? Because in retrospect, talking to local providers, I found out there were people out there who could help, but I didn't know it. And, they're not putting up big billboards. There's not a high profit margin on behavioral health supports. So I came up with this idea. I worked at probably 1,000 conversations until what we have now signed into law and being implemented across the state is the Michigan Crisis and Access Line. And what that is I could call as a mom, a sister, a neighbor could call for somebody to find someone to help their loved one. But a nurse, a school nurse could call, somebody at a health center can call, an emergency room person can call, a police officer can call and find out what next. What can we do to have that warm handoff to make sure that that person, that child is getting the supports that they need so desperately? Because I have found over and over again, if you're not there that first time, that person thinks they will never have the ability to get help and they'll never ask again, because it's gut-wrenching to tell your story. And if you find that nobody wants to help you, you're not going to ask again. And then it's just a whole spiraling. So it's that early intervention, early access. So this crisis line is going to be a big help for our community health centers as well. It just went live in April in Oakland County and the UP. And the governor put out a press release a few weeks ago saying that they hope to have a massive expansion across the state. So just utilizing all my partners. And this is the only hotline that has this type of extent in the entire country. And it just came from a very dark time in my life, not knowing where else to go. And so I feel for people. I just had a conversation with a mom whose 19-year-old was suicidal, went to the emergency room and they were told, "Oh, you're fine." After going through that gut-wrenching experience of saying what they're going through, that person will never trust anybody again.
No.
So this is a chance for each one of us to be able to say, okay, then what? There you go. Let's make sure that this connection happens early. And, it's going to decrease anxiety, depression, suicide, people in jail. If we get people the help they need earlier, especially with children, because we know how many have ACEs and trauma in their lives. And if we can help those brains and to have the tools for them to be able to survive and thrive in this world of ours, I think that's the best thing we can do. That's why these school-based centers are vital to our future.
Yeah, I couldn't agree more. And I know us at SCHA-MI, we're very excited about your hotline, and we'll do our part in promoting it and make sure that, everybody hears about it and has access to it. So
yeah, and then we can segue into the fact that where do people go if there is a true crisis? Right. So I was fortunate to work with my colleagues in the governor's office, the department, to have a bill signed into law for crisis stabilization units. So these are freestanding centers where you walk through the door and you get the help you need. Right now, you go to the emergency room, they're set up for heart attacks, for broken arms. So the child, the adult sits in there until someone can come and help them. And then if they need a psychiatric bed is another issue. So the one thing, I white papered this a few years ago, thinking about the entire continuum of care that people need. And one is the CSUs, crisis stabilization units. Another is to make sure we have enough psychiatric beds. So I put a proposal in the current supplemental bill that's going out there to have a massive expansion in psychiatric beds, but to behavioral health professionals, this is the first year that we got an uplift. So in Medicaid, which is a lot of our population, the reimbursement isn't very good for professionals. You can have a professional have all Medicaid patients and not be able to put food on their table because it's so low, when insurance is about 6 times higher than that. So I did an uplift this year to almost double the Medicaid reimbursement rate in incenting people to take care of our children. So that's been folded in this year and is active. And I hope to see that access for children. And from the clinic perspective, and you're trying to find that warm handoff to someone else for more intensive services, that you can have that. And we're going to have more and more people willing and able to do that. But mid-level providers too, psychiatric nurse practitioners are filling this gap more and more. And there's 2 programs in the state, 2 universities that offer this psychiatric nurse practitioner program. And I found out it's a hot new profession. They have so many people coming in to do it.
Yeah.
And I mean, it's not my field. I was ER, but people want to get into this field. So these mid-level providers can start popping up around the state. There's also connection over at U of M. Any pediatrician can call U of M, I think it's MC3, and talk to a pediatric psychiatrist to help with medication management. So we've got more and more resources available for our children. And I just keep trying to keep that ball moving down the hill so that our children do have these really important opportunities.
Yeah, and we thank you for it. And oh my gosh, you've been busy.
Yes.
And so bringing it back to how school-based health centers can fit into your kind of overarching, comprehensive, vision for the state moving forward for helping people out. Could you tell us about what your kind of current budget recommendations are in the Appropriations Committee for the House? What is that looking like? What are you proposing right now?
Okay. Well, so what I've learned is with these health centers, there's startup costs involved. And then, as you guys all know, it's a partnership from the community, public health, getting reimbursed by Medicaid, private insurance, the school, it's everybody working together, but there's cost to get that started up. So that's what we've been appropriating money for the past few years to keep this expansion to a sustainable model. And so what we're proposing in this appropriations bill with the federal COVID money is just a huge expansion. Off the top of my head, I'm thinking it was about $10 million. You probably know, but I think that'll really help. So we can, ideally, we need to have one of these in every county, and more, of course, in more populated counties. But that's what I see. And I want everybody to just rev up their engines, put together their plan, because I can appropriate it, but you guys have to be boots on the ground getting this work done. And then I'll make sure and get this follow-up work done so that we can get you guys into a sustainable model.
Absolutely. Yeah. As of right now, and I'm sure it'll change by the time this comes out, I believe it's a $20 million federal appropriation for one-time funding. So again, for everyone listening, once that does come through, whatever that final number is, yes, please, and reach out to SCHA-MI, and we can put you in touch with Representative Whiteford, as well as if you need help on your grant writing, let us know, because that funding is going to go to a lot of good use and it's going to help a lot of folks. So
yeah, and that's what's so great about Alex and the team, is they're just boots on the ground, ready to make it happen. And so they're huge advocates for our kids, and going down to our county and all our county levels and the school-based community health centers.
Oh, thank you. So other than obviously, reaching out for these grants, what else can, not just the network, but any other, community members, family members that are, tied to the network, what else can they do to help support, your vision and some of your other colleagues who are, partnering with us and trying to move forward child's health as a whole in school-based health centers? What else can they do?
Well, I've definitely found in this world of politics and government, the squeaky wheel gets the grease.
Yeah.
You bring your stories. You start with the heart, go to the mind, bring your stories, what's really happening, and then give us an idea how to make it better. Doing this together as a partnership is the only way that we're going to have success. I cannot do this by myself. I chair a $28 billion budget now. It's so complex. But getting those real stories are incredible, real solutions. I sit there and I try to come up with solutions for things as well, like I did with that crisis line. You know, no lobbyist paid me to do that, right?
Exactly.
But that's so much. We don't need these high paid lobbyists doing everything. They have a role, of course.
Mhm.
But I think the biggest impact you can have is coming together, reach out to your local legislators, bring your stories and say the impact you have. And it is very, very impactful. Your voice really matters, especially when you're reaching out to your personal representative or senator. Also reach out to the department. They want to do a good job too, of course. And they're a very important part of our partnership because they're the ones who are actually boots on the ground, getting that middle road before it gets down to you guys at the local level to help. But doing this together, I think we can really have a huge impact for our kids.
Yes, couldn't agree more. So Representative Whiteford, I don't have any more questions for you, but I want to give you kind of one last, time to, the floor is yours. Any last kind of thoughts and, impact points for the people who are watching?
Yeah, so there's one other thing that it's a bill package I just introduced today. It's 7 years in the making, and it is a redesign of our behavioral health system for Medicaid. So these are all our children on autism, our children with developmental disabilities, severe mental illness, all of this. We've got this big systemic way that we finance public behavioral health. And really, I'm not sure that you realize this, but every county gets a certain amount of money based on the population there and the number of people on Medicaid. And then your local community mental health takes that money and then does their best to help the people in their community to stay at home. And if they need extra services, they can. It's always has bothered me how little money actually gets down to people. And so I've worked on this. I've researched all over the country, and I found a way to do it where the money actually follows the person. If the community mental health agency is capable of doing that care, they can. If they can't, there's something called network adequacy. And so another company can come in and provide those services. It's person-centered, people served have a very big voice on the oversight committee. So it's really a generational bill package that just got introduced today. 4925 is the first of 5. So keep your eyes out on it. I've worked really close with advocacy groups as well as people who provide services. And I've got a lot of bipartisan support. I have 21 co-sponsors, as well as 5 sponsors on the bills, just working with everybody. So keep your eyes open. It's actually projected to save $300 million, and that money will go directly to help people. And many of them are the children that we're hearing from their families across the state where they're just suffering so much. So keep your ears open. But that's the final part of my white paper that I talked about the other day. Yep.
That's true. Thank you so much. We appreciate your time, Representative Whiteford. You are a true champion for children and just anyone who feels underserved, medically or through their behavioral health needs. So thank you again, all the work you do. We know you work tirelessly. So thank you so much. We feel very blessed to be able to partner with you.
Well, the feelings are mutual. So thank you, everybody. Thanks for what you're doing for our children.
Perfect. All right. Take care.
Bye-bye.